Dr. Doug Goumas. He is a surgeon with the New Hampshire Orthopedic Center, specializes in knees and ACLs. And welcome to the program, Doug. How are you?
I'm doing very well, thank you. Happy holidays.
Happy holidays to you. We have a running argument here, although we have a fellow who's hasn't been here for a couple of weeks. We don't know when he's coming back. Might be like shipwrecked someplace. JJ Truman. But we have a running argument about Tiger Woods. He says he's going to come back and be the player he was. I say no. Now Sean, who's with us as well, says he's. Were you the one who said he's done?
I've now come back to your side.
Done.
I thought for the longest time he would, but I've been watching intently and I don't see it. So I've now crossed over to your side, Dave.
So I wanted to ask you about Tiger, the injury, the ACL problems that he had, since you specialize in that particular area. How much can that have changing Tiger from the greatest golfer of his era to a guy who's 9 back or 8 back at the Masters today?
No, I'm with you guys now. Initially I thought that it was his personal issues which really kind of sidetracked him. And I think initially that was the case. But his knee, I think, is a significant factor. But it's not so much because, he had an ACL reconstruction, because we do ACL reconstructions on high-level athletes, high school, college, pro sports, and a lot of them go back to playing without an issue. Tiger's bigger problem is that I could tell you with probably 99% certainty that he has some arthritic changes in his knee. He's had 4 knee surgeries. What that tells me, someone who's had 4 knee surgeries, just by definition, has some arthritic changes going on in that knee. And I think that's very, very hard to play at such a competitive level, especially, he's in his 30s now, and you got these kids who are in their early 20s whose health is health is fine. And I think that's a major problem. With the ACL itself, fixing an ACL and getting people back to sport after an ACL is not the issue. But with his issue, it's more of his, the arthritic changes he has in his knee and the problem he has with his cartilage.
Are there certain sports that it's tougher to come back from an ACL? I mean, I know I one time playing basketball landed on a wet spot and hyperextended both of my knees at the same time. Yeah. And I can tell you, it was. First of all, I thought I blew out both of my ACLs on this one thing, but it was excruciating pain for me to move even a minute amount laterally on my knees, and I had to play golf for that summer in sneakers because I needed that looseness at the back end. Is it harder? So I'm wondering if it's harder to come back in a game like golf because of the way your legs move from an ACL than it is maybe in another sport like football or baseball.
Well, I think that, I think that there is some truth to that. I mean, and again, I think that we're concentrating too much on the ACL. I think his ACL is not the issue. I think that, in your knee you have ligaments and cartilage. You have the meniscal cartilage, which is, people oftentimes talk about, hey, the doctor scoped my knee, took out some cartilage. The meniscal cartilage is 2 discs of shock absorbers that are in the knee. And then you have the articular cartilage, which is the coating on the thigh bone and the shin bone. And when people develop arthritis, it's that coating on that bone that kind of wears away. Now, whenever you bend, squat, and twist, you really load both the meniscal cartilage and the articular cartilage in addition to the ACL. Now, people that have ACL problems have problems with instability. The knee gives way. That's not Tiger's problem. I think Tiger's problem is the fact that he probably has some arthritic changes to that articular cartilage, and every time he pivots and torques and twists, he's loading that cartilage and it causes pain. And for the recreational athlete, now we can make some modifications as we're golfing. That might, and that's certainly going to change our game a bit. But I think that at the high level that professional athletes like to play at, if you have a problem like Tiger has with his articular cartilage, I can't see how we'd be able to get back to, to where he was before. I mean, a perfect analogy would be, we see lots of patients with shoulder problems, and I'm sure your listeners and yourself have heard about injuries to the rotator cuff. And recently I was at a sports meeting, and there was one of the top shoulder surgeons in the country, Jim Andrews, and a lot of people have heard of him through the media. And he actually made the comment that, any professional baseball pitcher who has had rotator cuff surgery never returns to the starting lineup. And my point is, and my analogy is that, if you're playing at a recreational level, it's one thing. But when you're playing at a professional level, any injury, whether it be to the shoulder or to the knee, it's going to be really difficult to get back to your pre-injury status.
Now, Doctor, one of the things you mentioned, you're talking about the cartilage, and one of the kind of the key words when anyone has surgeries, especially in this instance, Tiger Woods has had 4 on his knee. One of those key words that comes up is usually scar tissue. Now, can you elaborate on that? Would that have any effect on his knee, and is there, in fact, a possibility of those things happening to him after 4 surgeries?
Yeah, and again, I would say that perhaps, if that was after his first surgery, for example, we do ACL surgery on people, and then sometimes, 3-4 months after their ACL surgery, they might have the inability to extend the leg all the way out straight. They might have some ongoing inflammation and pain. Certainly, that could be associated with scar tissue. But after 4 surgeries and some continued pain in your knee, it's not scar surgery. It's not scar tissue. It's not your ACL. That's a mildly arthritic knee. That's the problem.
When you're talking about arthritis in the knee, what actually is that, and what effect does it have on the in his case Tiger or the other athletes? What does it do?
The analogy that I use with my patients, if you're out with the guys and you're eating chicken wings and you look at the end, of the chicken bone, you see that soft white cartilage.
It's my favorite part.
Exactly. And you and your buddies are drinking beers, gnawing on it. That's the stuff that in time is going to break down. Now, arthritis, comes in from 2 causes. Number one, all of our bodies are pre-programmed to develop breakdown of that cartilage, and we're doing knee replacements on people in their 40s and 50s and 60s, and a lot of those patients, their parents have had arthritis in their knee, and it's basically it's pre-programmed. But the other way that people can develop arthritis is from any kind of trauma to the knee. So if you injure your ACL, not only do you injure that ligament, but with that initial injury, in all likelihood, you get some cartilage damage, because as soon as the ACL goes, you get the cartilage of the thigh bone bangs against the cartilage of the shin bone, and a lot of times you'll see bone bruising. And when we get in there arthroscopically and we look at these things, you'll see damage to the articular cartilage as well as the ACL. So certainly with his original ACL injury, he may have had some cartilage injury. Now, I know that he's also had meniscal surgery, and the meniscus is the shock absorber that's in the knee. And, whenever you remove a part of the meniscus, depending on how much you remove, it increases the stress and the forces between the cartilage at the end of the thigh bone, at the end of the shin bone, and that can also cause that articular cartilage to continue to break down, even if you don't have a family history. And the fact that he has had 4 knee surgeries tells me, we see this all the time. You've done an ACL on somebody and you've seen them back a few years later, then a few years later. Every time you go back in, you see that articular cartilage and even that meniscus kind of worn down a bit more. So I think that's his problem.
All right, so put this in the bottom line, excuse me, because we have to run along. But and I've got to have you back on because I want to talk a little bit later about, you're talking about rotator cuffs, and we've got Daisuke Matsuzaka coming back from Tommy John surgery. But rotator cuffs, a rotator cuff injury to Steve Busby in the 70s with the Kansas City Royals was where pitch count started in baseball. He was a phenom. He'd already pitched 2 no-hitters. And he tore his rotator cuff, and from that point on, when he was coming back, they went to pitch count. So I want to talk to you at some point about durability of pitchers. Are they as necessary? Why could guys in 1904 throw 435 innings and last till they were 40, and guys, go for an IV drip after 100 pitches now? But can't get to that now. But anyway, right. So you're saying you don't think Tiger is going to come back to being the dominant player he is? Is that what you think?
Again, anything's possible, but I think that, anything's possible. But again, I think that as a result of his knee injury and at the level that he's playing at, where, it's 1 or 2 strokes is gonna determine whether or not you're going to win a tournament. And you know what? If your knee is a little sore and you're gonna slice it, you're gonna hook it, it's gonna change your mechanics. I would be very surprised.
Yeah, so it's a chain reaction, really, isn't it? I mean, you got one
Absolutely.
thing leads to the next. Your swing changed a little bit, and that's how Dizzy Dean hurt his arm. He broke his toe in, I think, the 1937 All-Star game. Got hit with a line drive, and in compensating for the pain, he changed his motion, and one thing led to another, and he blew out his arm. So
I mean, it's all related. It's all connected. I can tell you a perfect example is any patient we see that comes in that's a pitcher that has a shoulder issue. The first thing we do is work on his legs and then his core. We like to work on his shoulder first.
All right. Well, Dr. Doug Goumas from the New Hampshire Orthopedic Center, I want to thank you very much for coming on. Appreciate it.
Absolutely. My pleasure. And you and your listeners, everybody have a great Easter and holiday season.
You too, as well.
Yep.
All right.